3 magical points that can eliminate a multitude of different wrinkles. The first is the transfer zone. Use your index and middle fingers. Place your index finger on the inner wall of the eye socket and your middle fingers go on the bridge of your nose. You tilt your head, relax, and start to feel tension in your bones, beginning to create such a light vibration. You will feel the tension in your eyes lessen, the tension in your forehead lessen. The next points are right under the nostrils. Place your fingers and start massaging them. You can also do this light vibration relaxedly for about a minute or 2. Third exercise, in the area of the jaw corners. You've placed your finger, you feel tenderness here. When you start to massage or create a gentle vibration, relax the lower jaw.
So what is castor oil? Well, it comes from the seeds of the Ricinus communis plant. The key ingredient, ricinoleic acid, a powerhouse fatty acid that gives castor oil its anti-inflammatory, antibacterial, and ultra-hydrating properties. Users see an instant plumping effect thanks to its deeper penetration than almost any other product. And it combats the acne, killing the bacteria without clogging pores. It actually balances oil production, so it's safe for not only drier skin but also oily skin. Very unusual for an oil because a lot of oils are either used for people with drier skin or oilier but not both. But that's why castor oil is so ubiquitous.
A drooping eyelid makes you look older, gives your face a more tired appearance, and honestly, it doesn't look very appealing. And a lot of people think there's nothing you can do about it. They believe that if you have it, the only solution is dangerous blepharoplasty to get rid of it. But today, in this video, I'll talk about all the reasons why drooping eyelids occur and share an exercise to help you deal with it. But before we get started, please check if you've subscribed, because it really helps my videos get promoted on YouTube. You know, I also had a drooping eyelid when I was a kid. And even now, you can see that my upper eyelids are pretty heavy. I've had this issue since childhood. Actually, I wouldn't even call it a problem. It's just a genetic fact. People, especially those of Asian descent, tend to have narrower eyes and heavier upper eyelids. I actually inherited something from the Asian race too, so my eyes are a bit narrower. What's most interesting is that over time, of course, I've worked on my face, and I noticed as a side effect that my eyes started to open up more, my eyelids lifted. Because even if you have a genetic predisposition, even if you've had heavy upper eyelids since childhood, with techniques for working on the skull and stagnant fluids, you can open them up a bit and make your eyes look more open. Of course, there will be a limit to how much you can improve, but in any situation, you can make things better. And for those who noticed that you had beautiful, open eyes since childhood, but then something happened and they became more closed. If your gaze has become heavy, then that means you have a deformation type even more so. And due to changes in the skull, tissue swelling, and facial muscle tension, the eyelids started to droop. You especially need to work on this problem, and you can bring the situation back to normal. In most cases, if you practice regularly. And now I will show you the techniques, and now I will show you the first technique. We will be stimulating the lymph flow. If we look at the problem of a drooping eyelid, this little bulge here contains a lot of fluid, because there's actually a small pouch here where fluid accumulates. Why does fluid accumulate there? Of course, there are many different things that need to be addressed. Ideally, you should work holistically with your whole body. That's what I teach on my program. Because your posture, neck, and skull all affect the drainage from your face. And especially when you wake up in the morning, you notice that your eyelids are puffier. This is due to chronic swelling. So now I'll show you a technique you can use. So first of all, you need to regularly do lymphatic drainage with your fingers. That is, lymphatic drainage works like this: all the fluid from your face moves towards your ears and then down your neck. So with your fingers, you start smoothing and pressing all the fluid out toward your temples and then down. Just do this about 30 times, more or less, okay? Keep doing it, do it 30 times. You can do this over your whole face, about 30 times each area, and then move on to the eyelid. So, here's your eyebrow. You grab your eyebrow and start gently kneading it like this. You can even use your lower finger to go along the eyebrow and the drooping eyelid like this, and you're removing all the fluid that's built up here. Since I'm an osteopathic doctor and work holistically, I want to say that if you don't address the deeper causes, which I teach about in my academy, you won't be able to eliminate the root problem, and the fluid will keep accumulating here. You'll just need to do the massage every day. If you are able to eliminate the causes, then the fluid simply won't accumulate here. If you already have a noticeable buildup of fluid, then you should do this kind of massage. And then go over the forehead again and down. And do this at least 30 times. In the mornings, especially if you feel your face is swollen, you do it like this. What's next? What else can you do? Let's move on to the second problem, which is related to muscle spasm. Because if we look around the eye, right here is the circular eye muscle. It's like a sphincter. But when you squint, it contracts. So what happens when it contracts, right? If it's in a heightened spasm, the eyebrows start to drop down. So this whole area starts to get squeezed. See, there's a difference, right? Or when the muscle is relaxed. So, is this connected to the muscle? So if you squint, if you often concentrate, if you experience certain emotions, especially negative ones, yeah, that leads to the muscle tensing up. And what do you need to do? There's a simple solution. What can you do? You can place your hands on your eyebrows and lift your eyebrows. Just start raising your eyebrows. And notice that right after this, your eyebrows will immediately start to rise. So you lift your eyebrows up and start squinting. Squint for 5 seconds. Then take a breath in and out. And then do a light vibration upward. Okay, great. And do this 5 times, at least, right? Once again, raise your eyebrows and start squinting. Squint for 5 seconds, then inhale and exhale. And do this kind of vibration, lifting your eyebrows up. So this technique allows you to relax, and you'll notice that your brows and eyes start to open up. The third reason. So, you need to work with the muscles. And basically, I teach how to work with all the facial muscles, because every muscle matters and can cause different problems. Right. And the third layer, an even deeper layer, is the skull. As we age, our face and skull change, and the skull ages too, especially if you don't pay attention to your posture or take care of your skull, which also absorbs both physical and emotional tension. Because, essentially, bones are just like ligaments, only they're calcified. And considering the fact that connective tissue itself, fascia, acts as a kind of semiconductor, that is, it transmits nerve impulses, electricity, tension and blockages can accumulate in it, and collagen itself has the ability to contract, which is why the face starts to tighten and deform. The skull can also contract and deform with age. This can lead to asymmetries. And the very first thing you might notice is that with age, if your face and neck were more elongated in childhood, your head becomes rounder and wider. And the eye sockets too. In other words, everything starts to press in. Especially the frontal bone, when it's tense, it creates pressure on the eyelid and also disrupts circulation, causing swelling. That's why working with the bones of the skull plays a key role in improving appearance. Because when we work with lymph or with muscles, we have certain limits. If you work with the bones of the skull, you can further enhance the results with a variety of techniques. I actually teach how to work with the skull and osteopathic techniques on my faceplasty program. And it's precisely these exercises for working with the skull that deliver the best results. So if you want to look 5 or even 10 years younger, want to tighten your face, lift droopy eyelids, then join my rejuvenation program. You just need to go to the link in my description box and start your journey of youth. By the way, I want to point out that right in this area, where the drooping eyelid is, that's where the lacrimal gland is located, and any glandular tissue responds to any stress, tension, or emotions with swelling. And that's why, when you work with the muscles, especially with the skull bones, with the frontal bone, the lacrimal gland is located right under the frontal bone, you can reduce the swelling, and then the eyelid will lift and your eyes will open up. Friends, I record a lot of useful content for you from the bottom of my heart, and I do it with great pleasure. And my large team edits these videos so that they are as concise, brief, and useful for you as possible. Please subscribe to the channel and be sure to like the videos, because it helps them get promoted on YouTube. This was Dr. Alesh with you, and I'll see you in the next episodes.
To look younger, it's not necessary to immediately run to a plastic surgeon and have surgery, or to a cosmetologist to inject fillers or Botox into your face. There are other methods. Today, I will show you simple exercises that will help you instantly look 5 years younger after performing them. And if you do them regularly, you can look up to 10 years younger. There are important muscles on the face that lead to premature aging. These are the chewing muscles, specifically the masseter and temporal muscles. Here they are on the screen, you can see how they work. The fact is, they are constantly involved in the act of chewing and often spasm due to stress. When these muscles contract, the face becomes, literally, the lower part becomes heavier. That is, if you feel it, the youthful angle here starts to disappear. Here, puffiness and swelling appear, a kind of heaviness. That is, lymphatic drainage occurs through this area. If this muscle here is tense, it creates swelling on the face. And the temples too. When this muscle is tense, it seems like our eyes, they start to kind of droop down. and the face literally starts to change from a more oval shape to a more round one. I recommend you first, place your fingers under the cheekbones, right from the bone, and place your fingers under the cheekbones. And check if your cheekbones are at the same level or not. Because when you perform the technique, you will feel and see that the cheekbones become more expressive and symmetrical. Place your hands on the lower part and test your face. How easily it responds to lifting. If there is heaviness here, then we will work with it and then see what changes. First, you find this muscle and start to rub it with your fingers, literally like this. Look, rub it. That is, you simply take the fibers and start kneading it. It's normal, that is. If you find a painful spot, start kneading it. No need to force it, that is, slowly relax and breathe. Exhale. That is, spend a few minutes of your time on this. Gradually, you will simply feel that this muscle becomes softer, it relaxes. Then we move lower. Find a painful spot and start kneading it. And breathe. Inhale, exhale. Then we go down. And right here, where it attaches to the bump, you also knead. You can do it with one finger or with your fingers low. Like that. Do it on one side and accordingly on the other side. Grab it, hold it, and rub it. You may feel that your cheekbones are freeing up, the lower jaw, it will become lighter. It's as if it descends downward. And after you've relaxed it, you can spend more time on it than I am right now. Next, we need to stretch it. Look, it's very important not to pull the skin. You need to grab the lower jaw and simply pull it downward. Then, if you pull the lower jaw, your skin, if you look right here, remains mobile. And there, it's the muscle inside that stretches. That's why you grab the lower jaw, like this. With the base of your palm, grab the angle of the lower jaw, like this. And the mouth, we completely relax. And it's like we pull down with our hands, while reaching up with the crown of the head. And as a result, the muscle here starts to stretch. And this way the face will elongate, you stretch it out. And so for 2 to 3 minutes, you directly stretch the lower jaw and then we move on to the temporal muscle. Now look at the temporal muscle. If you place your hands here and clench your teeth, you feel it. Here it attaches, and what you need to do is first of all massage it. You can simply take it like this and stretch it. Just take it and stretch it out. And while doing this, open your mouth. Just perform this technique. You can do it starting from the cheekbone. Place your fingers and start like this. Completely relaxing the jaw and stretch it out. Temples. That is, you need this entire area to completely relax. And then you can even smooth it out. Take it like this and just smooth out each area. Smooth it out on one side and then on the other side. That is, you will feel that it will be easier for you to open your mouth, and it seems like your gaze becomes more open, as if your face becomes more elongated and wider. This provides a good facelift. And these exercises that I am showing are the basics. But, of course, for a better effect, you also need to work with the skull bones and other muscles. So click the link below and take the first step towards rejuvenation with my free course. Be sure to subscribe to the channel because every week I post new videos about rejuvenation and health improvement. Give it a like. This was Dr. Alice with you, and see you next time.
Sagging facial contour, nasolabial folds, jowls, these aren't skin problems, but the result of disruptions in the deep facial layers. Place your fingers around your ear and start making circular motions, stretching the face toward the ears. Do this for 1 to 2 minutes daily. After that, place one hand on your forehead and the other on the back of your head and begin to pull the fascia upward. In this way, you will smooth out the facial layers.
How can you tell that you might develop jowls? In just a few weeks, you will see amazing results. One of the biggest problems that can add 10 years to your age is having jowls. This is a deformation of the subcutaneous tissue, as a result of which the contour of the oval of the face floats and the face immediately becomes older.
But there are a few magical techniques that can solve this problem in just a few weeks. And that's what I'm going to talk about today. First, I want to explain why jowls occur in the first place. There are several factors that contribute to their appearance. The first is the biomechanical factor in our body. All organs and tissues are interconnected. And when deformation appears here, it is associated with stress. Not only in the face, but also in the neck, in the chest, and even in the stomach. The second point is just fluid, swelling. Chronic swelling on the face leads to the fact that the soft tissues of the face begin to deform prematurely. Because the fluid, under the influence of gravity, constantly presses down and stretches the skin and soft tissues, the inner face. The third point is psychosomatics. Our face expresses all possible emotional patterns, and there are many facial muscles on the face. And you can even see in this picture how emotions, tension in the lower third of the face around the lower jaw, and chronic tension in the facial muscles. Ultimately, this will also lead to tissue deformation, swelling, and the appearance of jowls. Now I'm going to show you how to get rid of jowls. But in reality, you can get rid of any problems on your face. You just need to know the techniques and perform them correctly for a few weeks. Why does deformation occur? If you look at this picture, it shows the different layers: skin, subcutaneous tissue, muscles, bones. When tension arises in the muscles and bones, you can see here, highlighted in green, are the lymphatic vessels. Muscle tension creates swelling in the area of the fat tissue, the subcutaneous tissue. Stagnant fluid starts to deform the skin. As a result, jowls appear. Jowls have a distinctive feature because the face is divided into certain fat compartments or packets. Fat compartments between which there is a ligament, and here is the characteristic area where jowls appear. This is a fat pack where the muscles are located, and if there is constant tension in this area and fluid gets stagnant, deformation occurs. And that's how these hanging jowls appear, here in this area. What other muscles affect this? If you look at this picture right here, you can see it clearly. So chronic tension in these muscles, specifically the platysma, is highlighted in green. This is the platysma muscle, the one under the skin. This is the muscle that lowers the corner of the mouth. These two muscles in chronic tension, they cause deformation. Why do they tense up? They express emotions, sadness, sorrow, and gloom. And these go down to the subconscious level, means that these tensions go deep into our body, that is, into the deep inner layers. And even later, when a person relaxes, he still displays the facial expression of a dissatisfied person, and these jowls appear. This is why psychosomatics can already lead to premature aging of the face at the age of 30-40. And now I'll show you a simple diagnosis to understand if you might develop jowls. It's very simple. When jowls start to appear, there is noticeable tension in the front part of the neck, and right here in the area of the lower jaw. If you throw your head back and feel that you have a tension here, this tension indicates that you already have what looks like overstrained muscles and fascia, which in fact will lead to facial deformation. The second point is that such heaviness can appear on the neck. For those people, especially women who have pronounced heaviness, it indicates that they are overstrained. Often, jowls are connected with heaviness in the neck. The next point is chronic swelling. If you feel that fluid is constantly accumulating here and your face becomes puffy, especially your cheeks, then you understand that it's just a matter of time. It accelerates the aging processes of the tissues many times over. I recommend that you put on a glove or wash your hands. Next, we will be doing an intraoral technique. So our task will be to grab the corner of the mouth where it actually attaches. This is the muscle. Do you see? Our task will be to massage this area. Massage, and you can also vibrate. This helps a lot. So you take your finger, place it in the oral cavity, grab the corner of the mouth, and start making circular movements. At the same time, the other hand can hold the lower jaw. After you've done the circular movements and the vibrations, you finish with kneading massage movements. In order for the tissues to relax, they need to be kneaded so that the stagnant liquid comes out of there. The fluid comes out best when the tissue is already relaxed. Then you make a massaging movement. As you do, that is, you grab the cheek from both sides, up to this area of the corner of the mouth, and begin to rub the jowl area between your fingers. And so you do it for a few minutes on each side. For a few weeks, you will see amazing results.
You just need to do these techniques every day. In fact, kneading only the cheeks is not enough. I mentioned there's also the subcutaneous muscle of the neck. You can see on the screen that when it tenses up, it creates these bands, and this also contributes to the line of the jowl. You can work with it easily since it attaches to the rib cage. You can place your fingers right here on the area, under the collarbone, and start making gentle circular movements. Don't pull too hard, just release the tension and make circular movements. You'll feel how this muscle stretches just in this position. Gently pull it a bit. You can also rub it to help those fiber bands relax, and then they will release. So you can do it on one side, then the other. Well, of course, even that might not be enough, because as I said, the jowls can develop starting from the pelvis. Because imagine all the muscles, fascia, organs, they are all untied. So when I pull even a shirt, there's tension. So even if there's a scar deep in the pelvic area, like after a C-section or from... I talk about how to work with all the issues in the body on my channel. So make sure to like and subscribe. See you next time.